Hi, welcome back to the Chris podcast. In medicine, there are doctors, and then there are people who quietly change the course of a specialty. Today's guest is one of those rare individuals. At a time when pediatric cardiology was not even a defined field in India, he chose to walk into the unknown, training at some of the finest institutions in the world, including Boston, London, and the Cleveland Clinic, and then making a decision that defines legacy, coming back to India to build from scratch. From setting up one of the earliest pediatric cardiology programs to innovating techniques that are now used across the globe, to impacting thousands of children and families, many of whom would have otherwise had no access to care. His journey is not just about medicine, it is about courage, conviction, and creating something where nothing existed. He is a teacher, an innovator, a builder of systems, and above all, a doctor who chose purpose over comfort. Today, we go beyond the CV into the mind, the struggles, the decisions, and the philosophy of a man who helped shape pediatric cardiac care in India. Please welcome Dr. Bharat Dalvi, sir. Hi, sir. Please welcome for our show. I am very honored and very happy to have you for this podcast, sir.
Thanks for having me over.
An ailing grandfather who had no diagnosis, someone in the family suggesting this is what happens to a family when there is no doctor, and then you deciding since then that you wanted to become a doctor. Please tell us about that story, sir.
Yeah, so this was when I was maybe 5 or 6 years old. And my grandfather, my father's father, became ill. And almost we were not in a position where we could spend money for his hospital care. And we were completely washed out. The finances were just not existing. So his brother, that is my father's uncle, told me that this is what happens to a family. It gets completely wiped out if there is no doctor in the family to guide what should be done and what should not be done. And you will not believe that it had such a profound impact on me that from that day onwards, I said that I want to become a doctor. And my friends and their parents would always say that there was one boy in the class who, when asked to write an essay what he wanted to become, always said that he wanted to become a doctor, right from second standard onwards till such time he passed out of secondary school certificate boards. That is the SSC board that we were in. So that one particular episode, you can't even believe, had a very profound, and I have no regrets that I pursued my dream of becoming a doctor.
So many years and still on the path, sir. Today, anyone can take up anything, but the focus, there's so many distractions for us, social media. And how did you manage to be on the path since then? What made you so focused?
So there are two things. One is that I'm not good at anything else. So that is an advantage to me. So there is no distraction. See, if you're good at music, if you're good at art, maybe if you're good as a playwright or acting in a drama, then you have many avenues to follow. I was lucky. God was kind to me in the sense that He didn't give me any other ability except probably a little bit of things in medicine and now subsequently in cardiology and pediatric cardiology. And that is one of the reasons why I'm so focused. It's not out of choice, it's out of compulsion. That because I'm not good at something else, let me be good at this.
But then KEM happened to you.
Yeah.
And you entered the medical college. And you had colleagues and friends who pursued different things in their life apart from being doctors. Did those interactions with them help you later in life to have an interdisciplinary approach that you had? Do you feel at ease by just communicating to different fields, coming back to yourself, coming back to pediatric cardiology, and then making those connections. How did it change you overall as a person?
I'll tell you, Nila, it was really one of the best things that could happen to me that I walked the corridors of KEM Hospital and St. J.S. Medical College. Not for anything else. Not only that people were very good or bright in terms of in medicine, but there were some guys who were extraordinary in many other fields. There were some great dramatists in my class, some great playwrights. One of my friends was shortlisted for Olympics for long distance running. So we had such great people in our class that just being in their company, rubbing shoulders with them was really fun. So medicine was not so much of stress because of these people. I could enjoy. And those were probably the best years of my life. Spending those almost 20 odd years at KEM really did me a lot of good, beyond teaching me the basics of medicine.
So, apart from friends, we always have that one mentor or one person we usually look up to, whether it is medicine or any other field. We need someone who takes care of us, who nurtures us. Who was that person in your life, sir?
So I will tell you that I won't say that it was one person, but I was fortunate enough to have a number of people around me who helped me and who made me what I am today. Really speaking, if you say right from my start, my parents, I'll tell you very frankly, I owe a lot to them. We came from a middle class family, and but one thing was there at home was the importance of education. So no matter what I did otherwise, as long as I did well in my studies, all other things were pardoned. And the importance of education that was seen in my household, I think, was the first stepping stone for my professional career subsequently. And I saw them, the amount of sacrifice. You know, there was nothing like, I don't think they ever went out on a vacation, nothing. Whatever they earned was meant for us, for our education. And they never said no. For any book, they never said no. I mean, during our times, there were not many teaching, coaching classes and all. But whatever, one or two, yes, they would say, please go ahead. Then when I entered my medical school, I think I had some really great teachers. So one of them was in the Department of Medicine, Dr. Dastur. And then subsequently in the Department of Gastroenterology, Dr. S.R. Naik. So from these two people, I learned what is intellectual honesty. So if they did not know something, they would get up in a meeting and say that I don't know this. And this was at a time when, as I told you, in an era when boss was always right. So there was nothing that the bosses did not know, so we thought. But these two people taught me that there are a lot of things which we don't understand, which we don't know, and that there is nothing wrong in accepting that you don't know this or you don't know that or whatever. And then I went into cardiology. Of course, I had many of my immediate seniors, Dr. Tawani, Dr. Satyavan Sharma, Dr. Emma Kulkarni. But one person who really inspired me to become a pediatric cardiologist was late Professor Suman Kinare. She was a chief of cardiac pathology. And she was the person who really encouraged me in becoming a pediatric cardiologist.
But then at that point in time, you were treading a path which was filled with darkness. You didn't know whether you would lean on the right, on the left. And now you are the torch bearer, where you have shown light on that path by walking in an unknown alley. How did that happen? How much courage did you need to take? Was it risky? Did you feel that, oh, I don't know what's happening. My colleagues are saying, no, that's not the path you should tread on. And you still made that choice. How did that change? And
so I will tell you a story. You know, when I decided to get into pediatric cardiology, everybody told me including my mother, my wife, they said that this is not something that you should be doing because there is no future, including some of my teachers. They all were trained in pediatric cardiology, came back and started doing angiography and angioplasty. But one thing is that basically I'm a contrarian by nature. When somebody says that you should not be doing it, I always want to do it. And I'm not joking, but when I went into pediatric cardiology, none of us, not only me, but none of my colleagues really planned a career or had an agenda that if I do this, I'll be benefited. Nothing like that.
Right.
We just liked it. So we said, no, we love this, we want to do it. And that's how I went into pediatric cardiology. It was, it was not out of some kind of conviction or that I had some plan, nothing. It just happened to me. And that's why many times I feel that you may say that it is your hard work, it is your passion, it is your intellectual honesty, but I think beyond this is your destiny. I was destined to do what I am doing. So your destiny, some people may call it God or some people may call it by whatever other name, but I think plays a huge role in what you are and what you become in life.
So you do believe in destiny, in Almighty?
Yeah, of course I do. Every morning I pray. I have absolutely no hesitation in saying that.
But do you also feel that there are some things in your hand and some things not in your hand? Do you think that some part of your career was planned and some part was unplanned, or would you completely say that it is destiny?
No, I'm not saying it is completely destiny. But what I'm trying to tell you is that destiny has a huge role to play in your professional life and in your so-called professional success. You have to be at the right place at the right time with the right kind of people.
Wow.
Who will let you grow. And that is the reason why I say that no matter how smart, no matter how hardworking, no matter how passionate, if you are not ably supported by your destiny or by your luck, you won't reach anywhere in life.
And then luck took you to Boston, it took you to London, and it took you to Cleveland. Please tell us about your global exposure at that point in time, sir.
So I will tell you very frankly, I had that way no godfather in cardiology who could just write a note to somebody in Boston or somebody in Cleveland or at Great Ormond Street. So I had to apply for various scholarships because I did not have money. I lost my father when I was 23, 24. And my mother was not working. So I could not even think of going to Delhi by aeroplane. So where's the question of going abroad? So I applied to number of scholarships. And I used to go to various trusts in Mumbai and sit outside their office, and apply for scholarships. And then come back to KEM at around 5 o'clock, 5:30, and then work till 10 o'clock. So my day would start at 7:30 in the morning till 3:30 at KEM, 3:30 to 5:30 outside the trust buildings or trust offices, come back at 5:30, again till 8:30, 9 at night I would work. And that is how I collected money for going abroad. And I was lucky. I got some major scholarships like ECFMG scholarship. Then I got Dr. P.N. Berry scholarship. I got Cleveland Clinic International Medical Scholars Program scholarship. And of course, the Fulbright scholarship. So these scholarships would take me to these places. Now, the most important thing that I learned at these places, one of the things that I learned was that the people who write books, who give talks, are no different than you and me. The second thing I learned that I was not that bad as I had thought I was when I was in India and I used to read all those books and all those articles. We tend to think, these guys must be something else. They come from some other planet. But it was not like that. And there were some people who were extraordinary, but they really constituted not more than 1%. Most of the people who were in these very big institutes were like you and me. So that gave me the confidence. Otherwise, a guy who is born and brought up in middle class family, leave alone doing, but can't even dream of big things. But when I went to these places, I suddenly started dreaming of big things. So this gave me a confidence which was really very, very significant. And that is what changed my entire approach to my life as well as to my professional life.
That's extremely very, very inspiring, sir. And it really is inspiring because you are one of the few authors from India to have contributed to the structural heart intervention textbook by Dr. Horst Sievert. And it fills us as young interventionist cardiologists with a lot of pride that, oh, this is Dr. Bharat Dalvi, sir. Going to that part of you, which is the academic part of you, you have a number of papers to your name, a lot of academic work, and you were a part of an academic institution until you were 40. And then, only then you ventured into private practice. Tell us about that part, because by that time, a lot of your colleagues would have already entered private practice, and you could balance that part. How did you do that, sir? Because a lot of our viewers would be in academic institutions wanting to make that transition, take that risk or not take that risk. Please tell us your experience regarding your part in academic institution and then subsequently into private practice.
So it's a great question. I'll tell you, when I was in medical school, or rather when we were in medical school, nobody cared what watch you wore, what jeans, which brand. There were no mobiles, but whatever there was, or did you come in a car? Because most of us came in buses or in trains. Very few students in my class had cars. So it was an era where people were judged by how smart they are. So if you are a smart guy, you would be given far more credit than somebody who is a rich guy who has all the resources. So that was probably one of the reasons why money did not matter all that much to me. And thanks to my parents and subsequently to my wife, that they didn't demand anything out of me. So I was free to earn maybe 4, 5, 6,000 till 1997 when I left as associate professor. My pay at KM Hospital was 11,000 rupees a month. And I never complained. I thought that I was a king. I had everything in life. I never thought that I did not have this. Many times I used to stand for a bus to go to KM, and many of my registrars or even my students, they would be driving in a car and would give me a lift to go to KM. But I never felt bad because I don't know, it was not probably a part of me to have cars or to stay in a big house or nothing. I stayed in a house which was 390 square feet. Me, my wife, twin daughters, my mother and my aunt, 6 of us stayed there and very happily. So because that was not a part of my agenda to make big bucks, I was very comfortable being at KM. And the kind of respect that the teachers got was huge. I had such great registrars, such great housemen, that they probably compensated for all the lack of money that I had. And it also, many people think that it's a sacrifice that we share, but I don't think. I think it's a great investment.
Wow.
It's an investment because I got exposed to more of academics. I could go to various places in India as a speaker. And subsequently, all these scholarships came to me because I stayed at KM for such a long time. So, and lastly, when I came into practice, all my students were the ones who referred me patients. So that way, even financially, it was a great investment, which I didn't realize when I actually did it. So I think that everybody who is a doctor will earn a reasonable amount of money. There is no need to, fast track something. Money will come to you. That's what my belief is. And I think that was my belief then as well. And that is one of the reasons why I could stay in KEM for almost 10 to 11 years after I passed my DM cardiology. And I have no regrets at all. I really, if somebody asked me, would you do that again? I would say, absolutely. I would do that again. I spent some of the best years of my life in KEM, interacted with some of the smartest minds.
So you said very interesting thing. You said that was not the agenda to wear the best watch, to go in the best car. That was not the agenda. What was the agenda? What is the purpose which drew? So Daniel Pink in his book Drive, he says that there are three things which drives a person. Intrinsic motivation. He says it's autonomy, it's mastery. But yeah, there are three things which drives a person. What was your driving force? If it was not this agenda, it was not the materialistic life that you wanted to chase, you were feeling like a king, you said, and you still feel like one. So, what was the agenda?
So I will tell you, and I don't want to hide it from you, that coming from the family that I came from, I had a burning desire to succeed. In my opinion, this seed was sown in me by my mother. She, when I was probably in second or third standard, she had told me that you can do whatever else you want, but when it comes to studies, you should do well. And that stayed with me for a very long time. And even till today, I want to succeed. Not that I succeed, but that is a burning desire. And I wanted to do something different than what was already existing at KN. And only with that single motivation, I said that I'm going to take up a full-time job and I'm going to try and see what KM can do in terms of clinical research, because that was probably possible at KM. You will not believe, when I was a registrar, I was taken, or I went for one of the CSI meetings, Cardiological Society of India, and I saw there were 35 papers from All India Institute, 40 papers from PGI, and KM had one paper. I came back, I was so enraged. I came back and I questioned the head of the department. What are we doing? I was mere registrar. And I was so upset. So when I became a faculty, I said that no, I'm going to change it. And you will not believe, by the time I left, we were presenting 35, 40 papers at CSI. We had so many publications, national, international journals, and most of my registrars, most of my lecturers had so many publications. They went all over the world based on their CV. So to start that, it took some time. But once people got the hang of it, it became a culture in the department.
That's fantastic. But you said you wanted to do something different.
Yes.
And that desire to do something different, was it the only source of innovation? Or living in a family which was a joint family of 29 people,
Right.
did that inculcate the qualities of empathy, the qualities to adjust, to be flexible, to talk, to communicate, and overall, all of which led you to think differently than most of us? How did innovation happen to you? Because as the world knows, you have innovated techniques 20 years back and still practiced today, like the balloon assisted technique for large ESD device closures, or the very recent, the BZ sheath. So, because innovation is something which is not actively pursued in our setups. We are too busy doing some things which may not be innovation per se. We learn those innovations which was innovated in somewhere else. How did this part also come in you, sir?
So I will tell you, one of the persons who is responsible for making me think a little differently, or trying to think in a way where people have not thought in that direction, is my colleague from my medical school, Dr. Dilip Karnad. He's a physician and he was my roommate in RMO quarters. So whenever I used to say that, I want to make this, I want to present this data of 40 patients of this. And that was the trend those days. 50 patients of atrial septal defect, 40 patients of tetralogy of Fallot. So every time I would say that this is the manuscript I want to write, he used to ask me, what new are you telling the people through this manuscript?
Okay.
And this one particular question, whenever I write, even today, or whenever I plan a study today, I ask this question to myself. If I'm not going to say something new, then why do I write this manuscript? And that is why initially, yes, to understand how to write a manuscript, how to review a literature is good. But once you reach that state, then I don't think there is any point in writing a number of manuscripts. It's better to write 1 or 2 manuscripts, but write them in such a way that they will change practice.
How?
So he had a great influence on my thinking as far as newer things are concerned. That is what I learned from him. And then when I used to go out and I used to attend meetings and workshops, I used to see where people are faltering all the time. And then I would say that, okay, this is a question worth pursuing. And that is how balloon-assisted technique. I used to see people struggle, recapture, redeploy, recapture, redeploy. So I asked myself, is there something I could do? And at that time, we used to use those circular balloons for balloon sizing the defect. So when I failed 2-3 cases in a week in a private practice. Failing 2-3 cases of ASD closure in a week is a disaster. The word goes throughout Mumbai within minutes that, this guy failed today, this guy failed tomorrow. So when I failed 3 times, the 4th case when I was about to fail, I said, let me use this balloon from the other side. So I just punctured. And I don't know, I used that balloon from the other side and it worked. I thought maybe a fluke. Next week, another case. Again, I used. And these are all large ASDs. I'm telling you the story of 2001, 2002.
Right, sir.
30 millimeters, 32 millimeters.
Right.
And 3-4 cases we could do in succession. And then I thought that probably I'm looking at completely new technique which has not been described so far. So that is how this ability to invent something new, it comes from there. That what new can I do in a particular procedure? So first, most important, to identify a problem.
Right.
That is the most important thing when you want to do some kind of innovation. Same thing, you take large sheaths into the right ventricular outflow tract. People are struggling in large right atrium, large right ventricle. That is when I realized that why not track a sheath on multiple guide wires? And I knew that the dilator of 14 French sheath can take 3 or 4 guide wires. I knew that because of my previous experience with, some of the dilators which we had used for ASD closures.
Right.
And that is how I came with the BZ sheath of using multiple guide wires to give additional support and trackability to these large and long sheaths. So identifying a question, I think, is probably one of the most important things.
So after so many techniques and devices that you have put your mind to, would you say there is a template of innovation? There is a template that you can follow to innovate something?
I don't think that there is a template. What I would say is that as you innovate, there are 2 things that happen. One is that you get a gut feeling which innovation will work and which innovation may not work. I'll tell you just in a minute, people think that I have a great idea in my mind. Your idea may be absolutely great, but the first question that you should be asking yourself, how often will you be able to use your idea? If you are going to use your idea once a year, it may be the most brilliant idea. Nobody is going to market it.
Correct.
In today's era, you have to give it a thought, right, to marketing. So the second thing is that even if you have a greatest idea, but if it is going to cost you $1 million, how many people are going to use it?
Correct.
So these are very important things that you should think about when you come out with a new idea. And believe me, what you think is a new idea, most often is thought over by somebody else.
Correct.
You know, so to make certain modifications so that it can be patented, that you don't infringe on somebody else's intellectual property rights.
Yeah.
Those are the issues, they come to you a little later.
Yeah.
But that gut feeling, you know that this is something which will work. And then taking it to the industry and then taking it from bench to bedside. It's a very long journey, very tedious journey, especially in India, where we don't have that ethos and nor do we have that environment, you know, like you have in some of the Western countries, mainly in the United States.
Do you think it will change in the coming times?
101%. I see the change. I see the change when I'm working with many of the companies in India. I see that change, and definitely it will come. And I'm very hopeful. And I'm sure that, you know, the younger lot will have many more ideas to explore. And I think we will be, I'm not saying we'll be the captor, but we'll be one of the aspirants in this field of innovation in interventions.
That's very inspiring from someone, from something coming from someone like you. And then Lifetime Achievement Awards. That has happened to your life. CSI Lifetime Achievement Award. The Pediatric Cardiac Society of India Lifetime Achievement Award. So I was thinking on it, and there are two words to it. Lifetime and achievement. You've been seeing kids and infants from a very small age, and you know what a lifetime is, and you know what an achievement is. According to you, what is a lifetime and what is an achievement?
See, to tell you the truth, achievement, I'm not very sure what it means actually, but at the end of the day, if I can go home and sleep with a sense of satisfaction that I have done some good to some families, I have not done any harm to anybody, not cheated on anybody. I think that to me is truly an achievement if I can do it day after day, month after month, year after year, for the whole lifetime, if I could do that. Of course, there are some days when you may not be able to actually do what you went out to do because there are failures, there are complications. But overall, if your purpose is pure, then I think that, to my mind, is the biggest achievement in terms of your professional life. And if you can do this consistently, then I think you have probably achieved something. All these awards which come, they are, they are not really, you don't plan for them, or you don't just, they just happen to you. And I don't think that they make as I always said, that you are no different person the day before you got the award and the day after you got the award. Is just, but I should not also be telling you something that is not from the bottom of my heart, that I really feel good when I get this award, because acknowledgement is something that even a small kid, if he's acknowledged, feels good, and it's no different for me. I really feel good, but that is not the purpose of my work or of my general way of life that I want to. And I never like one thing is that I don't like to kind of go and find out whether I could lobby for an award or for an honor. That is something I really consider not, I mean, it's below my dignity to do these things. I won't do that. Okay. But yes, this is what I mean, that when you talk of lifetime, it's mainly the professional life. And this is what I mean by an award, that it's a sense of satisfaction at the end of every day.
And then we talk about professional life, and then also naturally we live a personal life. I'm sure you would have had anchors in your personal life, someone who always was by your side, your family, your wife, your children, your mother, your parents. How big role did they play when you were going, traveling length and breadth of the country, making these therapies work for people, proctoring cases, spreading the awareness of pediatric cardiology? How did they take up uh, your travel schedules and on and off absence and presence? How much is their contribution to your life, sir?
Huge. It's a huge contribution. I mean, see, I'll tell you very frankly, if you're not at peace, you cannot do good work. I'm not talking good academic work, even good professional work. You have to be at peace with yourself. So you have to be at peace with yourself at home, and you have to be at peace with yourself at the place of work. And I was really very, very lucky in that sense, because it's very difficult to live with me 24/7. It's not very easy. So, but my wife, she never complained. As a matter of fact, she always encouraged, and she held the family together, even my daughters. Because I know of so many times when I would say that let's plan a trip, and then, there's a complication, and I'm then in the hospital day after day trying to salvage a baby. And when I came back, my daughters never threw a tantrum. The first thing they would ask me when I came back, because the trip was cancelled, how is the patient? Is the family okay? So, because of this, and that's what I tell you, that people call it by different names, but this is what destiny is all about. That you should have good people around you to encourage you, to support you. Because in medicine, when you get into complications, especially with children, it's not that simple. It requires a tremendous courage to come back again, do more cases after either there is a major catastrophe or even a death. It's not very easy to gain back your confidence. And that time you need family, you need some great mentors, you need some great peers and colleagues to bring you back. So that way I was very, very lucky in having a wonderful wife and two great twin daughters.
Please tell us something about ma'am. Rashmi ma'am has been an accomplished hemat-oncologist herself, and her career has also been inspiring. Please tell a few words. How did you both, in your initial years when you were both at the peak of your career, could manage everything that you did?
See, I'll tell you very frankly that Rashmi is very smart and she's very good in what she does, but she, out of her own choice, voluntarily, took a back seat, letting me grow and do what I could do in last, 35 or odd years after our marriage. So in any family, I think it's very difficult for both career-oriented parents to really do things the way they want to, and yet keep the family together and bring children with good values, bring up children with good values. I think Rashmi did all that, and she never complained. And as a matter of fact, she always took pride in what she did and always encouraged me. As a matter of fact, she never liked me sitting at home. She would always ask me, what new projects are you doing? I don't see you work on this. I don't see you work on that. So she has been a great sense of encouragement. And what I believe is ultimately, it's a team.
Wow.
It's a team. In cricket, somebody bowls, somebody bats, somebody keeps wickets. If everybody wants to be opening batsman, it won't work. You won't win a match. In order to win a match, you need that winning combination. And that's where I think, Rashmi helped me a lot.
And talking of cricket, sir, your passion for cricket.
Absolutely.
A few words on that, sir.
Really speaking, I wanted to become a cricketer. Okay. But when I was a child, cricket was not really anything which would be successful in terms of financial reimbursement.
Correct.
So my father was very particular, and he told me that you have a choice. Because I would go for every match at Brabant Stadium. I knew statistics at the back of my hands. I played cricket for my school, for my college, for my medical school, for all 5 years. I used to open the innings, I used to keep wickets. And I had many cricketers subsequently as my patients, so I had a very close interaction with them. But after some of these, frauds in cricket, I completely lost interest.
Oh.
And I hardly follow the game now. Once in a while, when some friend says that let's watch a match, that's the only time I get to see cricket. Otherwise, and the reason why I went, my father gave me a choice. Either I join cricket or I go and study well. And so I said that after he told me that this is what happens if you only play and this is what will happen. So I said that, okay, let me go away from cricket. But I played till I passed MBBS.
So playing cricket, did that help you to become a better team player?
Oh,
A better leader?
Absolutely, no question. We don't understand, but in cricket, you sometimes score a zero, but you win a match. And the pleasure that it gives you is immense. Sometimes you have to throw a wicket, especially when you are running out. If suppose your partner is well settled and you think that he's going to take the match your way, you have to throw your wicket. You have to get out by staying out of the crease. So those are the things in cricket that really play a huge role in your professional or even in your personal life.
Yeah.
You understand how success is. It's not that you have to succeed, but the team has to succeed. So definitely, sports have a very important place, in my opinion, in one's professional and personal life.
Yeah. Also, you said team approach. With you were some of the earliest structural interventionists when structural interventions were not even coined. Structural interventional, the word got coined only in 1999 onwards. Correct. By Dr. Martin Leon. And you were doing all these BMVs and ASDs way before.
Correct.
When even the word was coined. Do you think team approach to cardiology will work better for the patient in the coming times when very high-end structural interventions are happening across the world?
I think that there are no two things. I'll tell you very frankly. Gone are the days when you said that I did a successful procedure, but the patient died. Those days are gone.
Right.
You have to convert every technical success into a clinical success.
Right.
And for getting a clinical success, you need timely referral. You need a great intensivist to stabilize the patient.
Right.
Great anesthetist to be at the head end when you are doing the procedure.
Yes.
Need great colleagues so that you save on time, and in case of a difficulty, you can always hear to their advice.
Correct.
You need great technicians too. And after the procedure is done, so it's not that once the procedure is done, the patient goes back to the ICU. Again, medical interventions, whatever the other interventions, and then goes home. So unless you are able to create that kind of a team, it's impossible to get great results. If anybody thinks today, in today's era, and of course imaging, such an important aspect. You have to have great echocardiographer, a radiologist, CT scans, MRI, and so on and so forth. If anybody thinks that as an individual he can carry the whole thing on his shoulders, I think he's fooling himself. It's just not possible. And the more we get into these advances, more is the importance of teamwork.
Right. So teamwork is inevitable.
Absolutely inevitable. Absolutely inevitable.
You mentioned something very interesting where ma'am used to tell you that what new projects are you doing. I saw a pattern of your life. You have been doing a lot of projects. Do you see life in projects? Like, do you see, okay, this is the current project, and once that gets done, you move on to the next one? Do you see life as a series of projects for you?
Really, personal life, I don't think can be a series of projects because there are so many people involved that you can't, say that this is going to up to a level, when the children are small and you're newly married, yes, you can probably think about doing small things. But subsequently, it is just beyond one person.
Right.
But when it comes to professional life, even today, every morning I get up, I ask myself this question: what new thing am I going to do in next 3 months or in next 6 months? And you will not believe, even today, I have half a dozen ideas which are doable ideas in my mind. The only thing that prevents me from doing it is because I don't have those kinds of resources. I don't have those many vendors who will probably encourage me to get those ideas into practice or give it a shot.
Correct.
I'm not saying that every idea comes to the market.
Correct.
Some of them may go in dustbin.
Right.
But I should have an opportunity to take that idea to its logical end.
Right.
May it be a dustbin, may it be a marketplace. Unfortunately, I don't live in that environment. And that is why I feel that if we can convert this, if we change the environment in our country, we will be really looking forward to a very great and bright future when it comes to interventional cardiology. Mainly from that point of view I'm talking, because that's the only thing that I think of most of the times.
Right. Yeah. So, how can someone make a place of his own in this super competitive world? No?
See, I'll tell you very frankly, competition was as stiff during our times also. It wasn't significantly less. I agree that with more number of people and with less number of seats, competition gets even stiffer. But there are two things that could probably help. One is, I think, rather than doing everything, if you do one small little thing and try and do it meticulously, keep the data, present it honestly, I think that helps. So I'll give you an example. Like in cardiology, yeah, I don't see many people. Everybody wants to do intervention because intervention has a lot of money, a lot of glamour. I don't deny that, but I think that if you take up something like heart failure, pulmonary hypertension, cardiac rehabilitation, whatever, cardiomyopathies, but if you take one subject and just go after it, I'm very sure that there is a lot of scope, and once people realize that you have achieved something in this particular thought, they will obviously, you will have your own referral base. So it's not necessary that everybody has to be an intervention, and you have to have that focus that, okay, I'm going to take it up and I'm going to do it well. And there are many such examples. Look at Nitin Burkule. He does such great echoes. Anybody has any problem in echoes, will go to Nitin. We have in Pediatric Prashant Bobate, who does pulmonary hypertension. Right. Anybody has anything in pulmonary hypertension, they'll say, Prashant, can you just let us know about it? So it's not necessary that everybody has to be an interventionist. Unfortunately, our outlook towards cardiology has become so skewed that many people think that interventions is the only way forward, which I don't think it is. And I think that is one of the ways of cutting the noise and remaining focused and do what you think would probably, take you through.
So now we come to a very interesting segment, and it's the rapid fire round. Please be as easy, as candid as possible. Sure. I will start. One decision that changed the entire trajectory of your career.
The decision that changed the entire is, I won't say it's a decision, but it's an opportunity to go to the Children's Hospital in Boston.
Okay. One failure that taught you more than any success did.
Is one of the complications of a 3-month-old child with aortic stenosis who had a embolism in his left main coronary artery, which I lost on table. And the amount of trauma that one episode or one case gave me, it taught me many things in terms of dealing with the problems, with complications, and not only dealing with complications, but dealing with families following a complication. I think that is one of the worst nightmares of my life, but it has taught me a lot of things.
Innovation or perfection? What matters more in the cath lab?
Of course, perfection.
One habit that has kept you consistent over decades in the cath lab and out of it.
Is my approach in terms of planning and in terms of having a protocol for everything that I do, including the puncture, including the pressing the groin, everything. For everything, I have a protocol, and for everything, I have a plan and a backup plan. That has kept me in good this thing till date.
And one consistent habit out of cath lab, which you do every day, irrespective of the schedule.
So that is my morning walk. Every day, all 12 months, if I'm in Mumbai, I walk for almost 45 minutes between 5 o'clock to 5:45 every one day.
Okay. A moment in your career that gave you deepest satisfaction.
Is the first time that I was able to close a large ASD using balloon-assisted technique. This is the retrospective way of looking at, but that was, I still remember that girl who was about to get married, was detected to have ASD, had no money. And she came to me. We failed the first, we failed the second time, but the third time we were able to do it. And subsequently, her brother came to tell me that she's married and living happily.
One thing young cardiologists focus too much on today. What is that one thing?
I think the one thing they focus too much is the rapid pace. That I think, pace in achieving everything. Professional success, material success, in publications, presentations, they want it very fast. I think that is one thing. They don't have time to really sit back and relax and enjoy the specialty. I think that is one thing which bothers me.
One quality that defines a truly great doctor.
I think is humility. Because I think when I was getting trained, many people used to think, because that is how it was, that the bigger the doctor, more arrogant was he. And I think I learned that that is probably not the way forward. I think humility, remaining grounded, is what makes you great.
Great, sir. If not cardiology, what would you have been?
Really speaking, as I told you, my second passion was cricket. I would have definitely may not have played at a very high level, but I was really good in giving cricket commentary. So I would have probably gone after some of this, or cricket statistics or some such thing.
Destiny or design? What has played a bigger role in your life?
Destiny.
In one line, what does a meaningful life look like to you?
Meaningful life is something where I would say at the end of, it's a tough question really, but I would say that you are satisfied at the end of every day that you come home. It's not possible, but that is what it means, that if I'm able to help as many people as I could in my lifetime, I think that would be a life well lived. So even today, I would always like to help as many people as I can. There are people who call me for problems of knee joint, problems of headache, which is not my forte. Correct. But I still like to help them. And many of my friends wonder how I take these phone calls and how I'm so patient with my patients and their family. But that is my nature, that I like to help as many people as I can. And that would be life well lived. That is what I would like to be remembered as, that this guy used to help whenever we had a problem.
Amazing, sir. One innovation of yours closest to your heart?
The innovation is, of course, balloon-assisted technique because it has withstood the test of time. In today's era, for a technique to withstand a test of time for over 2 decades, yeah, I think in a fast-moving world is, I think, a big thing. Excluded in majority of the meetings when this question is asked, that when you encounter a difficult ASD or a very difficult ASD, which technique you fall upon, and almost invariably the answer is balloon assisted technique. That gives me immense sense of pleasure and achievement.
One advice you wish you got at your age of 30.
Really speaking, I don't think that I really see. I was quite an independent minded person, so maybe that I got those advices, but probably having got no advice at that age was my biggest, probably the way I could think or I could do the things the way I wanted to do them rather than being bogged down by somebody's advice.
Wow.
Was a great thing that could happen to me. So not having an advice, I think, is sometimes the best thing that could happen to you.
Okay.
I know by that time I had no father, no godfather, no nobody. So I had to be on my own, and I thought that helped me a lot in making mistakes, in taking decisions. But I think that was something good that
That's an amazing approach to life with a lot of courage, conviction, and a lot of self-awareness, I think. Two more things I want to touch upon before we end this podcast, sir. One, you used to go to a remote place far off in Gujarat for almost 10 years, from 1987 to 1997, as part of your altruism, as part of your human approach to pediatric cardiac care. Please tell us about those days, sir.
So this was really, I was inspired by my surgical colleague, Professor Aniv Tendulkar. He used to go to Bidara for conducting these camps, and I would probably accompany him because he needed always a cardiologist to screen patients for surgery. And it was like we would see maybe a couple of hundred patients or even more, which were previously screened. And there was nothing, but there were many people, many volunteers who used to do some great work there. And we could not only identify patients, but the same organization, the Bidada Sarvodaya Trust, would get these patients to Mumbai, would keep them in some place so that they had a place to stay. They were fed, their operation was done in KEM, post-operative care was taken, and they were sent back to Bidara. So, and we must have operated hundreds of patients from Bidara. So in short, right from the beginning, I had that trend of doing dunyadari. And that is what was, this was just one of the examples. Even today, I love that. I never ever say no. You can take me anywhere, and I don't mind seeing as many patients as you want. If they are truly poor, I have no issues. Well, absolutely. And same thing in KM. I mean, we could see so many patients and do so much of good. So Bidada was just an extension of my passion for doing some amount of dunyadari. And that is what is done by most of the doctors. I mean, you will agree with me that most of the doctors really want to do this if there is an opportunity. The problem is that our system, people try to beat the system. Even people with resources would want everything free. That is something is not a great thing to happen to our profession. Yes, we are people trying to beat the system and even beat the doctors.
Yes.
Yeah.
The second question, I want to talk about your two other babies. The first is the Pediatric Cardiac Society of India and the journal that you started. Please say a few words about that, sir.
So Pediatric Cardiac Society of India was really not one person's baby. There were half a dozen people at that time who came back, who were trained in pediatric cardiology. And in adult cardiology, we would be treated like, the stepson or a stepdaughter or whatever you want to call it. So we didn't get the due credit. And the due exposure. So we thought that it was a good idea to have a separate society. So it was sometime in 1997. So 6, 7 of us got together and we started a Pediatric Cardiac Society of India. In 2007, 2008, at that time there were no elections for becoming a president. So it was by nomination. So I got elected or selected as a president of the society. And as I told you, that I always wanted to have a project. So I said that I must have a project. As a president, I cannot be just be there and say that I'm the president. What will I do? So I said, I want to start a journal. When I put up this idea in our core group meeting, it was called a core group at that time.
Yeah.
So they all laughed at me because there used to be a newsletter of 16 pages, which they could not produce every 1 year. And I was talking of having a journal. So they said that it's not possible. Why are you unnecessarily doing it? But that is what I say, that because I'm contrarian by nature, I want to do things when people say that you cannot do it. And I worked day in and day out for almost 4 years of my life. No social life, nothing. Because there was no secretarial assistance, nothing. And within 4 years, we had it indexed on most of the major indices. And I went for many meetings. I would see the ports from when I was a pediatric cardiology. I would really, I'm telling you that it gave me such immense pride to see those things. Sure. And then Bob Anderson was so happy to see those issues. And I remember in one of the World Congresses, he took me aside and introduced me to at least a dozen of his friends and his students, telling them that look at this man. He has no secretarial assistance, he has no financial assistance, he has nothing. And look at the journal he has produced. So he had a copy of my journal with him. So these are some of the high points of my professional life, to tell you the truth. And also pediatric cardiology is probably the highest. That is, I would say, it's my, that is what I feel the best thing that I could have probably done.
Great to know that, sir. So that also brings me to ask you one more important question. You were invited in Keynes to talk on being the most efficient in the most limited resource settings. And you had a talk at Keynes in 2009. We face these situations in our setups quite often, where we have limited resource and we have to perform at the maximum efficiency. You have sown the seeds and you have seen such trees grow and you have nurtured them. Please tell us about doing the maximum efficient work in the most limited resource settings.
See, what happens is that we have the number of patients that we need to deliver to are too many, and the resources may be the infrastructure in terms of cath labs, echo machines, may be hardware, may be human resources are extremely limited. So, this disparity between the disease burden and the resources makes it a double whammy, as they call on the Wall Street.
Yes.
Inflation and growth when they come together. So this is what happens in limited resource countries or low or middle income countries. Now, in order to get the best results in these limited resource, you need a few things. And one of the most important things is to understand that you cannot afford to waste anything. For the Western world, it is very easy. If one catheter doesn't work, they will throw it away, get the second. If this guide wire doesn't work, we cannot afford to do that. We have to save on everything. So save is not a 4-letter word. It should be the philosophy of our lives. Even a pair of gloves, you cannot afford to waste. The second important thing is failure is not an option in people who live in resource-limited environment. All of us fail, but it is not an option. We can't afford. Apart from morbidity and mortality, it costs in terms of money.
Yeah.
And that is why planning the procedure and planning it well makes such an important difference to preserving resources. And there are some basic things that we should learn in order to prevent failures or prevent complications. And many of my talks, I say this, that you need to plan your work. You need to work to your plan. You cannot be haphazard, just go and do some things. So these are very important things in your life. Many times the simple things, simple principles of cardiac catheterization you flout, and that is where you create complications. Right. Injecting without aspiration, pushing against resistance. Once you get comfortable with the procedure, you think that you have conquered. And that's the biggest mistake. That is where you create complications. So treating every patient as if it is your first case helps. So there are such number of principles which if you follow, even with limited resources, you can perform at a reasonably high level. I'm not saying that you can perform at the highest level. Probably there you might require some more resources. But just because you have limited resources, that is not an excuse for substandard performance.
And also, towards the end of this podcast, I wanted to bring this topic of leaving a legacy behind. You've been a teacher and an astute one and a great one. You have had students who are doing very well across the world. The sheer feeling or the intention to give back in terms of students, in teaching them skills, how important it is, that is number one. Number two, what will be your parting message to the young cardiologists who are watching this podcast? So these are the two questions that I have.
I think, Nilay, I think the biggest legacy that you can leave behind is in the form of your students. I don't think we have done any earth-shattering work that would remain as a legacy. But I think some of the principles that we worked on and some of the wonderful students whom I had the opportunity to train, I think probably they are the best legacy that one could leave behind. And the second question that you asked as to what message would you like? So what I think when I look back at my life, there are a couple of things that has helped me. One is I hate status quo. I don't like status quo. I always like to rock the boat, try and see what I can explore. And one of the ways of doing it is to try and go beyond your zone of comfort. What happens is, as you start growing older, you want to remain within your zone of comfort. You don't want to do something. I'm not saying that I'm at the cutting edge of intervention. Certain, I don't have that level of adrenaline, and of course, hand-eye coordination also plays a role as you start. But I don't want to accept that as one of the limitations. I can move somewhere else. It need not have a hand-eye coordination. I can get into innovation, artificial intelligence, whatever, on all other things. So one of the messages is that even when you are young, I think try and get out of your zone of comfort. And the second important thing, and the most important I feel, is don't fear failure. Many times we tend not to do things because if I fail, what will the people think? What will the people say? But unless you get rid of this fear of failure, you will never be able to go or take a step which is a meaningful step and which will help people to change their way of thinking or change the way they do things normally. So these are the two most important things which have helped me in my life. Maybe I can say that retrospectively, but even prospectively, I have always been somebody who wanted to, do these things by getting out of my zone of comfort and without really caring whether what people would say if I were to fail.
I also wanted to really touch upon this aspect of you being brought up in a joint family. Joint family is very intrinsic to Indian culture and tradition. We see joint family systems are disintegrating, people are becoming more and more nuclear. But the whole feeling of being, just that getting adjusted to whatever is going on and still excel. You did excel despite being from a joint family. Please throw some light on this.
I'll tell you very frankly, it's really a sad state of affairs that we are going away from our old culture of staying in a joint family, trying to mimic the Western world. I'm not saying that it's all hunky-dory. There are problems in it. But just as you lose something, you gain something. And in a joint family that you see on a day-to-day basis, so you learn to adjust to different people's moods, temperaments. And so it becomes very easy when you come to the place of work. Like, for example, in cath lab, you have so many personalities, different nurses, different technicians, anesthetists, intensive, and of course your colleagues. The people in imaging, people in actually doing interventions, surgical colleagues. So it's like a joint family, to tell you the truth. And if you have grown up in that environment, then adjusting to this environment becomes literally a cakewalk.
Yeah. Okay. So would you believe that that subconscious impressions of a joint family percolated
Absolutely.
in that family at large? Patients, relatives.
Absolutely. I think, and it comes to you so easily if you have grown up in that culture, that you don't have to make any extra efforts to really adjust to this environment at the place of work.
That's so relevant in current times when we are seeing, and I really wanted to touch upon this topic, how a closely knit family does help in the individual's progress as well.
Absolutely. And many times you don't realize it when you are actually staying in a joint family, how this is going to help you. But when I look back, I really feel that all these things really help you into making what you are in your professional life. It just doesn't go waste. It really rubs onto you somewhere, and for good.
Yeah. So CRISP is a medium and a platform where we encourage diverse opinions, new ideas, and of course, conventional teaching in cardiology. CRISP is a platform where all these new ideas, including imaging, intervention, structural coronaries, everything is discussed in one breath. How do you find these kinds of platforms to spread the word, spread the right message? What are your views on platforms like this?
I think it's a great idea, really speaking. And I think what you are doing is getting people together to discuss some of the issues pertaining to clinical medicine, issues pertaining to research, issues pertaining to teaching. I think makes a lot of sense. And so it's a great initiative. And I think I must really congratulate you and your colleagues at CRISP, who have really done a lot of things in last 2 or 3 years that I have been watching. And even the meeting that you have annually is really very well conducted, and it has a very different design. And I like the kind of dialogue that is established between the faculty and the audience and the moderators. It's a very different design. I have not seen it in any of the meetings that I have been attending, and believe me, I've been attending quite a few meetings the world over. Yeah, and I enjoy that that kind of a design of a meeting. I think that it's something that will probably stay and will grow with time. And I wish you all the very best. I think it's a great idea.
Those are super wise words, sir, because that can guide a lot of us on this path who may have or may not have got fathers, as you said, who can introspect within themselves and look where their career and their life is going towards. Lots of wisdom words in this entire podcast. Very thankful to you to have you, sir. And I hope you enjoyed this conversation too. And I hope to have more conversations like this in the future with you. Thank you very much, sir. Thank you. Thank you, sir. Thank you very much. Robert Frost, in his poem, The Road Not Taken, says, I shall be telling this with a sigh, Somewhere ages and ages hence, two roads diverged in a wood, and I took the one less traveled by, and that has made all the difference. That was Dr. Bharat Dalvi sir for us for this crisp podcast. The choice to build, the choice to persist when systems don't exist, a courageous life, an impactful life, a meaningful life, a purpose filled life, a true belief in the Almighty and the purity of intentions and purpose. Rest, as they say, is history. Sir, thank you very much, not just for this conversation, but for the lives you have touched, the systems you have built, and the inspiration you continue to be for so many of us in medicine. It's truly been an honor. And to everyone watching, if this conversation made you think, reflect, or feel inspired, don't forget to share it with someone who needs to hear this. This is Dr. Nilay Patel here for you, an interventional cardiologist. Until next time, stay curious, stay compassionate. Thank you.